Hi everybody, I'm Dr. Qazi. I'm a skin restoration specialist in Newport Beach, California. I focus mostly on acne and scars and pigmentation. I do a lot with facial balancing and collagen stimulation. I'm going to go through this particular case. As a patient I've been working on for about 2 years now, well, about a year and a half now. You can see her amazing results. This is after several sessions, though, in this case. I'm going to walk you through just how I did this and answer any questions. Really go through this particular case because it's really awesome what we were able to achieve for this patient. This was something that it took a lot of work, took time and patience, and early on she was originally saying that it was kind of going slow for her. She was feeling like maybe her collagen production wasn't enough, but she still ultimately, a year and a half out, ended up getting really incredible results. And I worked on her again just a couple weeks ago, and it's going to be even better. I saw her follow-up photos right now, and just it looks amazing. This was actually after several sessions in this case. Reiki's asking, was this after a single session? No, this was actually several sessions in this case. What I did was 3 sessions. I did 2 sessions in this photo, basically 2 sessions of ablative CO2 combined with Erbium laser and a bit of fractional CO2, also with 1 time of Subcision. I also did TCA Cross. Actually, in her case, we did 7 sessions of TCA Cross. And when she came in this day, I ended up doing some more TCA Cross and a more laser. I just saw her photos. I was just like, it's so smooth now, really amazing, because her scars were really deep, and they were pretty difficult to solve completely. And she really did want more of like that fuller look, where it just looks as close to amazing as possible. You could say she wanted to just like it was something that she was really trying to aspire for, and that's why she came to me. She really was just trying to shoot for just like the best possible result that she could ever have. Did everything else that she could do, and her collagen production was ultimately really good. It just ended up needing a few different steps just to be able to get this. Ahmed, how's it going, Ahmed? Ahmed is asking, what is the best treatment for grade 4 acne scars? I have tried fractional laser and TCA and Subcision, but no big difference. The problem may be that you have to do more sessions, or it could be that you have volume loss, and it sounds like you didn't do anything for volume, so you may need to do something for volume. And it's tough to really say until we really see. The grade doesn't necessarily matter enough. It's about really what kind of scarring you have, the location of the scars, and a lot of times people don't do enough for volume. A lot of times you have to do more volume than people think. It's really necessary. In this case, I ended up doing things where we did do a volume replacement with Bellafill in her case, and we got this, as Mrs. Jones is saying on here. I appreciate you coming on. Mrs. Jones saying beautiful result here. Tony Santana is saying, hey doc, results look amazing. Could she keep doing TCA to get a polished look? Yes, so that's what we did this day when she came in. I did a little bit more laser and then more TCA for her, so she's going to continue to get better and better results. And yes, to your point, we could continue to get it so it gets softer and softer with future sessions as well. Just like I don't want to use too much heat and too much energy unless we really need to. So I could do lower level lasers at this point, and that's why we have, we have a system where it's 55% off for future CO2 laser, or really any laser that you're doing for resurfacing purpose, and TCA Cross after you do the combination session. So we absolutely try to get it so that it's the best possible result after a single session. But I understand, especially with these kind of patients where there's more complexity with the scars, it takes a lot more work. And that could be involved really where we have to just be a bit patient, push out the lasers again 3 to 6 months later. And then if you did that combination session, the future sessions are 55% off. So we absolutely can do it that way. Let's see here. Wait, I have acne scars like that. How do I get rid of this, and what type of laser? So this was a few different steps. This is with TCA Cross. This is with Subcision. This was with laser as well, but it wasn't like the main and only thing. It was part of the whole process. It was involved there, but it wasn't the only thing there. Kyla Goodwell is saying, is there a limit to how many Erbium laser sessions one can get? I've had 10 sessions and not where I want to be. You may need more things though, not lasers. You know, it's not that there's a limit. Like I do erbium lasers every 6 months or so. I wish I could do it like more frequently. Actually, it would just be awesome for my skin. I just don't have the time, but I would 100% do more of it all the time. It's just amazing. But I'm doing it just for like just regular skin rejuvenation at this point, just to like get it's like anti-aging purposes. It just looks awesome for my face, and so that's why I do it. But for scar purposes, you probably need other treatment modalities. Erbium laser is one tool, and it may not be the best option for your types of scars. It's tough to say really. It's possible that you have scars that need other something else there. My dermatologist told me I can't do laser, so I should do subcision because my skin tone is Fitzpatrick 4. Well, it's good that they said that, really. The thing is that not everybody should do subcision, really. Not everybody should do it. It really involves a lot. It's a very precise treatment that, I should say it should be done very precisely. It should be done very, very carefully. And there's a lot of people who don't know how to do it. There's a lot of people out there. There's a lot of people who say they should do it and can't do it, and they shouldn't be touching it. So if they're not comfortable doing lasers, it should be that they shouldn't do it. But I do it all the time. I do Fitzpatrick 4. This is a Fitzpatrick 4 right here. Most of my patients are Fitzpatrick 4. Most of my patients are Fitzpatrick 4 and above, I should say. So I do a lot with that particular skin type, and I'll be happy to help you with that. How do I schedule an appointment? You could do it through my website at drqazi.com. Our prices are on there. Just go through that, and hopefully we'll help you out that way. Just go through my website. Just go to drqazi.com. All of our prices are there, and then we could just do virtual consultations there. Hi, Tylen. How's it going? Tylen's asking, had my Accure session today. Hopefully that kicks the last of the acne. Oh, I think it will. And especially since we're going to do moisturizing now and everything else, I think it's going to be totally fine now, actually. A lot more moisturizing. In your case, you really just moisturize a ton. I think it's going to be awesome, actually. People don't really, I know you do, but basically a lot of people don't understand that when we're talking about acne, I don't go about the way that a lot of people do, where they say just to overly dry the skin. When I was growing up, there was constantly saying just dry your skin, and it was like a really, really big component of it. They used to make it seem as if you just weren't washing your face well enough, and you just had to do some creams. Here's somebody, Roman, is saying, my dermatologist gave me doxycycline and it made my skin 1,000,000 times worse than it ever was. And doxycycline could help for a short burst, but like the way people had it on, like myself too, I had it on for they had me on probably for a year, and then they'll give me a little bit of a break and they'll keep me back on it again. And so I was going back and forth on those antibiotics, and then I was just overly drying my skin too on top of it. The way that it was just like constantly, the thought process is that acne, it's oily, there's oil production here, let's just dry your skin. And it ended up being that when your skin was really dry, what happens is that you get a rebound effect where you start getting some breakouts now because your body tries to produce more oil and it traps some bacteria on the surface of the skin, and you get more acne then. So, and the people that are really pushing it are people who don't actually have acne, I don't think. They don't have scars. So I can tell you that. I would just say that the people that have that don't really have scars and don't have acne. And otherwise, they wouldn't be pushing all this antibiotics for so long. They wouldn't be pushing the dry product, the overly drying exfoliants, things like that. Instead, actually moisturizing with something like Vanity cream, but you still want a retinol during the day, at nighttime, or a retinoid, like different cream or low dose tretinoin. Those are awesome. That's all you really need to do. It's like, and then of course, if you have like actual cystic lesions, then you need to do things for like the bacterial component of it, and like long-term solutions. Like we're talking about Tylen's right now, saying that she's doing the Accure session. So you could do the Accure, or you could do Accutane. All good options there. Eugene is saying, is it a great idea to get microneedling with PRP for boxcar and ice pick scars? I would say it's not. It's not a great idea. I think those are very complex scars. You need a lot more work than that. Tylen saying, also is pretty happy today in the office, is back to the bathroom. My scars look a lot better with the extra volume. Hope I can send the rest of the scar texture off over the year. Yeah, actually, you just started pretty recently for the scar portion of things. So that's awesome. Actually, it is kind of harsh lighting in our washroom, so I'm glad that improved. I actually looked at it the other day. I was trying to get something over there, and I realized it was kind of harsh in there. Not like, it wasn't like quite like the overhead lighting that we see sometimes in some lighting, but like I was still thinking that maybe it is a little bit harsh in there. And but I'm glad that it's doing better for you over there. So that's good, because that washroom is sort of like not too forgiving for some people. And it's like, like if you go to changing rooms, dressing rooms, and whatnot, you start to realize that this overhead lighting situation really needs to shift. Actually, in this world, we need to get rid of it. Sailor Moon saying, "Wow, great result. Appreciate you. Thank you so much." Io is saying, "What can I do if I can't afford laser?" Well, this was not just done with laser. There's a few different steps here, not just laser. There's a lot of different things that we have to do to get to this result. And by the way, can you guys hear me? Yesterday, people were commenting that they were saying that they couldn't hear me. Hopefully, people could hear me. On certain platforms, they keep saying they can't hear me, but hopefully it was. Talent saying, "Dressing rooms for sure my enemy. I don't even know what they do, why they do it. I don't know either." But actually, honestly, like, it takes a while sometimes. Like for myself now, at this point in my life, I only, although I only recently started the scar journey for myself, like properly, I really found that it really doesn't bother me anymore. So it's just really, really cool. And that was like the harshest lighting, like that lighting was really terrible. The elevator lighting was really terrible. So it's pretty cool. It's a pretty cool feeling. Cello saying, "I have a question, please. How long does hyperpigmentation fade?" It depends on the kind of pigmentation. How did it happen? Otherwise, it could take a few weeks if it's like after laser, to if it's more melasma where it's like blotchy and it's more like due to hormonal fluctuations or heat and sun exposure. It could be that it's there, but you could just make it less visible. Elarma is saying, "When doing Sculptra for acne scars on the cheeks, do you inject Sculptra as normally injected, or is it directly into the scar?" I actually do it directly into the scar typically. I do it actually pretty deep though. So usually along the boning process especially, I go pretty deep, and then I may do like a very dilute form just like around where there's like a lot of volume loss superficially. That's like pretty dilute there. Tony Santana is saying, "How long would I have to wait after finishing Accutane before starting scar treatment, particularly lasers?" I could do it on Accutane. I just don't want it like really aggressive, like high dose. But my patient today, actually, he's actually somebody who I did a scar treatment on about a year ago. He's actually a truck driver. And he is somebody who I just haven't seen for a long time, but he is otherwise exposed to the sun. And we had him on low dose Accutane. We still did another round of laser right now. There's a way to do it. I'm not focusing just on the laser, really. That's the reason why I could get away with it, because I don't do just like heavy laser, actually, especially someone like him who's exposed to the sun. He's on Accutane. And but we can still do it. Actually, it can maybe help actually with the healing process for some patients. The Accure laser, Accutane normalizes oil production, and then you get a more robust collagen response then. Sunset in Life is saying, "Do you usually do subcision once for the initial acne scar treatment and not again for following maintenance treatments?" That's correct. Yeah, usually once. Tyler saying, "If anything, you think they'd want to shine the light more on the body than the face to sell clothes." Exactly. Yeah. So that's just talking about the overhead lighting in dressing rooms. In dressing rooms, it's just like, it's really frustrating sometimes for a lot of people. But there is a point, at some point, for a lot of people that get to it, where it's like, it used to really bother you, and now it's like really, it has to be like a flashlight underneath your face and things like that, where you start seeing it. Other day, a patient actually shined a light underneath my face, like shined a flashlight to see my scars, and he's like, "You could hardly see anything right there." He's like, "I don't believe you had much scars." But actually, it's pretty cool to be able to feel that. It was like, I felt okay with it. Like, I was like, "You guys could take a look and see what it is." At some point, I'm going to do more treatments too. It's like, it's pretty cool that like I'm here at this point, able to be comfortable and confident enough in that. It's like, I never felt like that before. Talon's asking, also another good question, "How soon after Accure do you think we can resume scar treatments?" I want to make sure things are stabilized. So usually I wait about 3 months after the Accure session to make sure it's normal, bacteria is under control, everything else, and so then we could just hit it again then that way. So that's usually what I do. But we could also do a little bit of TCA still. That's fine. TCA is okay. I just wouldn't really do more like resurfacing lasers though. Elarma is asking, "What are your thoughts on Aerolase laser?" I think it's, it's okay. It's just more of like a jack of all trades type of laser. And that's typically not how I do it. I don't do lasers like that. I have a bunch of different lasers, and they're basically like designed for like each particular type of treatment that I'm trying to solve. Cherry's asking, where am I reading the comments from? There's actually multiple different platforms. So I'm on a few different ones at the same time, but I kind of circle back to where I'm at. I see all things at once. So let's see here. Where was I at? What would you combine with Subcision that's cost effective? Well, it depends. If you have rolling scars, then maybe we don't have to do lasers. Maybe we could get away with more like volume replacement. Maybe that's what we do. So we could do that. H&M lighting is the worst, apparently. That's what LFN is saying. H&M really has to fix their lighting situation. And H&M, wherever you are, fix your lighting situation. Lulu saying, I got my procedure Friday. I'm healing up pretty nicely. Awesome, Lulu. Thank you so much, by the way, for commenting. I always see you on here. Appreciate you. Talon saying, it's so funny to me that the Accure laser hurts more than the Erbium. Not that it hurts all too much today, but good. I'm glad it's not hurting too much. But yeah, these scar treatments don't actually hurt. The thing is also when we're doing subcision and other processes, it's really numb. So it's really going to be okay. I actually did my second step on a patient today, and she just did nerve blocks, and I did do fully ablative CO2, almost an entire face on her. She had a lot of thick scars there actually still, so I ended up doing fully ablative CO2 there. She had no pain. She's just like a total trooper with the whole thing. Jack Bautista saying, hey doc, is it possible to improve fat loss in the lower face area? Yeah, you got to go really careful with that area. You don't want to go too heavy. So usually what I end up doing is more with like dilute forms of Radiesse, some Bellafill. That's actually usually what I end up doing. I don't want to do too much with the volume at that one time because it's an area where we smile, we animate. Got to go pretty slow in that case. Let's see here. Someone's asking, how much would it cost to get this treatment? So I don't know offhand for this particular patient. She did require quite a bit of volume. She required basically 3 combination sessions for her. She really wanted more of like this fuller, polished look. It's probably going to run 12 to 15,000 if I had to guess about that. Potentially a little bit more, depending on what we have to do. So there's a lot of volume that sometimes we have to correct, and it's not as visible in this particular photo possibly, but when she smiles and animates, you can see there's a lot of fat loss around there. Resin is saying, hi doctor, do you recommend lymphatic massage, and if so, when after scar treatments? Yeah, lymphatic massages are great. We usually just do want to wait a couple weeks though afterwards though, so that's totally fine to do actually. Padgy's asking, do you think it could be better when collagen stimulator applies to the scar? I guess I have to ask what you're referring to with collagen stimulation. I did do collagen stimulating. I did Bellafill, which is cow collagen mixed with something called PMMA, and that PMMA integrates with the tissue and continues to make collagen over there. So that's hopefully what you're asking, but if not, let me know so I can clarify some more. Tylen's saying the numbing injections sure do work, so that's awesome. I'm glad. Sunset in Life is saying, is it okay to do fillers in the cheeks and under eyes after the initial big scar treatment? Yes, the answer is yes, we could definitely do that. And then maintenance treatments shouldn't interfere, right? And how long after the first treatment can we get filler? So these are all good questions. So we could do the filler the same day if we can, I'll mark it up that way. But if it does get swollen or we didn't do it that day, then I usually wait about a month for that swelling to go down. And then maintenance treatments, no, it's going to make it better and better, so there's no problem actually to do for future treatments. Like this patient, we had to do several rounds of TCA. She did about 7 sessions of TCA Cross just by itself. She's an excellent patient, a wonderful woman. Comes in and just does exactly what she wants to do, and she just was really shooting for just she really just wants as good of a result as she possibly could achieve. And we're pretty close to her. She came in this day. I was telling her already, she feels it really right now that it's really smooth, but she just wants it I just want to see how close I could get. She was robbed of her skin. She was robbed of it, really. It was like something that a lot of people that don't have acne, don't have scars, don't have pigmentation issues, a lot of people don't necessarily get that. They don't have like the full understanding of what that means when I say robbed of it. Imagine for people on here, I see a lot of my patients that are on here who don't have scars actually, which I appreciate, by the way, that come on, they just sort of listen or support. And, they're on here. And they may know, because they listen to this, but a lot of people don't necessarily realize that somebody was going through life, where they had a certain look and they were expecting to grow a certain way, and they always viewed their face a certain way. And then they had acne, which was really traumatic in itself. Like, for really, like, even if you have siblings and things like that, you could pay attention to it. If they had acne, you could maybe see like what was going on with them. And you could see that actually it's really tough for certain people, because it's like, at one point in their life, they were looking at like their life going in a certain direction, and this acne really stalled it. It stalled really their ability to go out socially. It stalled a lot of times just their confidence, their ability to interact with people. They felt that they were constantly, just looking at the way people were shifting. Their eyes were shifting. The way that, my patient I was talking about yesterday, he came on Friday. He said every time he goes to a party, he feels like people are looking at his scars on his face. He has surgical scars, and people would look at them. And he said that he even heard from a friend that someone was actually asking, did this guy get surgery and things like that. And it's really an unfortunate type of situation for somebody that's going through, and he's a handsome gentleman who views himself a certain way. And then because of these scars, he's just not as comfortable, as confident anymore. And now he's just feels like he can't go and interact with that. You'll hear so many people like that. So many stories. Look at right now in the chat right now. So many people are saying the same thing, that they're saying that essentially they couldn't actually, develop socially. They couldn't actually interact as much. And it's a story over and over and over again. We could get there to a point where it's like you feel much more comfortable and confident in your skin. I'm not saying it's going to be perfect, but the point of this whole journey, the whole story here, is we want it so that you feel really good about where you're at right now. And you feel like, okay, you went through a lot, you suffered a lot, but your skin is actually probably better than it could have been, actually, in many ways, because you did a lot of these things. It's like anti-aging. It's like things that are actually just going to make your skin quality better and better and better for a long, long time. So it's kind of cool in a way that you saw that, and that you wanted to fix this, because now we ultimately started working on the rest of your skin and improving it, and it actually looks amazing. Your skin just looks and feels better than it could have actually been potentially at this age. Maybe because I had acne and I had scars, I paid more attention to my skin and paid more attention to everything, and that's why at almost 43 years old right now, I feel really comfortable and confident in my skin. Maybe it is really, maybe it is possible that's what ended up happening. So it actually helped me out actually in a way. And not that I would go through it and ask for it again, if I had to go over again, but maybe there's an easier way. But you kind of look at it like that and think to yourself that you went through all that, you suffered it, and now it's you could get to a point where it's actually possible that you could have better skin than you could have ever had at that age, at this age now, which is kind of cool, because now you did it and you got there. Andy is saying, hi Andy, by the way, how's it going? Andy's saying, I experienced no pain during or after. Appreciate you, Andy. I had very little swelling, so I was able to go about my day, ate dinner, no big deal. I'm squeamish, so I hydrate, concentrate on deep breathing, and it's over quickly. Awesome, Andy. Thank you so much. Andy's saying, hi everybody from KC. Dr. Qazi performed a subcision at the mouth chin area yesterday morning. I've had him do this twice now, and both times the lidocaine numbed it instantly. I appreciate you so much, Andy, for saying that and coming on. And thank you so much for stopping by. So to the point though about this lower part, really what sometimes occurs, lower part of the face, I may have to do subcision again, because it's an area where I got to make sure that when we're going in there and breaking up that scar tissue, I'm not going too deep. I'm not using different tools there that could potentially cause skin laxity issues or displacement of fat. So in this case, I had to do 2 steps. I actually broke it up very, very well in the lateral part over here, but there was still an area where it was still stuck. So I ended up breaking that up, and it worked out really, really well there. Talon's saying, I like to think I'm dealing with these things. We all have a deep empathy for others struggling with self-esteem. It's not all bad. Yeah, I mean, that's actually true. She's saying also that I always wear my hair down to try to distract. My mid-face is relatively clear. It makes me sad though, because sometimes it's a lot of work to keep it maintained. At some point, Thailand, it'll be really, really exciting. At some point, I know you're excited about it too, that when you feel like you are comfortable and confident where it's at. You don't have to look at your previous photos, but you'll just be excited about where you're at, and like that's your life, and like you went through everything you went through, and here you are. And it's just like, it'll be a really, really cool process actually for people. There's a lot of people actually that just feel like they just couldn't see their previous photos and stuff, and it's like, it's going to be really, it's a really, really cool feeling just to see where you're at now at this point in life. Keep It Zen, by the way, is on. Thank you so much. Keep It Zen did Subcision a couple weeks ago, doing a Phenol peel in a couple more weeks. Keep It Zen saying, such a blessing to find someone who actually looks at each scar and each scar shape individually, since no two are the same. That's what keeps it fun for me, actually. And, you know, interestingly enough, it's actually really exciting for me. I like to problem solve. I always like that. I always like just three-dimensionally problem solve, use my hands. So it ended up working incredibly well for me, amazingly well. And when I was looking at my own face, I really did just kind of keep on looking at my skin, keep on looking at it, and just think to myself, how would I solve this issue? It was a problem that wasn't being solved, and I didn't find that anybody in my area in America really was capable of solving it properly at a high enough level. I really just didn't think so. And it was pretty clear to me that they weren't capable of it. So it was they're all just lasers, or I did microneedling, all that stuff. And it was I just found that this wasn't working. So I kept on looking at it, what is my scar type? What's happening here? And, that's how I ended up problem solving a lot of the stuff. I just kept on looking at it. So it's a lot of things actually, you could actually all look at things sometimes and see whatever you're doing and make it really exciting for yourself by problem solving. I told you about it before, but actually you could take a look at it. It's called Zen and the Art of Motorcycle Maintenance. It's an amazing book, actually. It really changed my life. I read it when I was 16, 17 years old, I think. And instead of basically getting frustrated when you're trying to problem solve, you get a real not just enjoyment, but there's this Zen moment, basically this total inner peace, this moment sometimes. Actually, it's actually occurred to me to date, at multiple points, where it was this complete calm, amazing sensation where I just broke up the scar tissue and just got there exactly where I needed to. And it's really, it's just this problem was very, very difficult, actually. Some of the cases actually in the temple area for my patient, I don't know if you're on tonight, her temples were so complex, and she got subcision done twice, actually. And there was still so much scar tissue there. And it was I realized that it just wasn't done the way it needed to be done. And it was so complex because the way that the scarring was, and they had put some filler in there before. So it just was not a virgin territory. But solved it. It's gonna be awesome. It was really was I remember it's sometimes these scars. And actually, my patient today, he flew in from Sacramento, and I saw him last year, and his scarring was so severe, so deep, and it was a Zen moment when I broke up his scars too. And he came in today. It's so flat and so smooth on him, and it's gonna be amazing. Actually, I don't think that he lets us share, but it's gonna be an awesome result ultimately for him. Tylen's saying, I'm excited for the day where I can see the old photos. As an artist, it kind of feels like looking at old work someday. It's going to look like that, actually. People are asking, do I have my photos? At some point, I got to figure it out where it's at my parents' house. I got to look into it. I have never get the time to go dig into my parents' I know that I just didn't take many photos, hardly any. And then at that time, the camera wasn't as good, but I definitely didn't purposely try to take photos of my scars. So it's going to be tough, but I feel like there was something that I did one time, to take photos of something that who knows where it's at. And sometimes, unfortunately, this digital stuff is at one point it was on film, and I probably had that stuff, and then everything got digitalized. And then it's yeah, well, I remember one time I had in my dorm, I had my cameras, and actually someone stole them in my dorm room. It was a wild situation, actually. And it was crazy, actually, in 2000. I remember that happened. It was terrible. And someone stole my cameras, actually. And so a whole bunch of stuff probably was on there. I had a bunch of stuff when I was in all over the world, and it was really upsetting, actually. And I suspected it was my suite mate, actually, unfortunately. And I asked him, I was listen, you keep the camera, just give me the digital stuff, and he didn't give it to me. But anyways, Spiro saying, I sent you a picture. I will see the picture. You should do it on the forum, actually. You go to my page at drqazi.com. Do it through that. Just go on the forum, actually, there. And then you can do it, actually, that way. What just got on the live, what treatment did you do for this patient? So this is a few steps. This is a few different times, actually. The first session, we did do subcision. We did excision as well. We also did CO2 laser, ablative CO2 laser on the edges, as well as erbium laser. And then I also did TCA Cross. And then we did some Bellafill that day even. We did some more TCA Cross. I did 7 sessions of TCA Cross. I did another session of laser. When she came in this day, we ended up, after this photo was taken, we ended up doing more CO2 laser, more TCA Cross, and a little bit more Bellafill. Is filler temporary? So, you're always going to get older. But of the fillers, really the longest lasting is going to be Bellafill. Bellafill is the longest lasting FDA approved product for acne scars, and it's at least 5 years. It's PMMA probably is just going to continue to stay there. So just so you know, so Bellafill is an excellent option actually for long-term scars, especially like more discrete spots like that. Do I treat PIE? Yes, it's part of my scar treatments. In fact, I believe actually this patient, we did do some of that as well as some of her pigmentation. I think we did do a pico session as well for her, and then also some of the some for the redness there. Triple X is saying Accure is not that far away. Do you think? It's a good question. I don't know. There's a lot of things that we were just really behind on, and you have to really ask yourself why that was. Really. Why was it that we were so far behind with scars and acne? Why were we so far behind? At this point in 2025, we really should have been a much more advanced. We should have had a lot more technology. We should have been able to do a lot more things. But the problem is that people, actually Thailand right now is saying, do you know why a lot of derms push for halo lasers for these issues? I got pressured into it by 2 derms about 1.5 years ago, felt like a waste of money. That's exactly what I was literally just about to talk about, talking about that right now. Because a lot of people were just pushed these lasers, and they never really tried to look and investigate how else should we solve scars. They were, we trust these people that are in charge of this. Everyone says trust the medicine, trust this whole thing, and it's like it's tough to kind of trust some of it. Then it's kind of tough. Because it's like, why didn't they solve this? Why am I even doing this stuff? Actually, sometimes I think so. Sometimes I wonder to myself, it's like, why did I even have to do this? I should have actually, my acne and my scars, my acne should have been solved when I was young. My scars should have been solved when I spent $3,000 or $4,000, on my scars. It should have been all solved for me. Why did I have to do this? I actually would have been, I'm happy saving lives, actually. I love saving lives. It was actually just enjoyable. I love doing this too, like, don't get me wrong, but like, I actually really like a lot of parts of medicine. So it's like, I don't know, it's like, this stuff should have been solved. They didn't solve it. They looked at this and they thought that this was a thing that they could throw a bunch of lasers at, and they're just going to look you right in the eyes and insist that you just have to laser things away. And then they tell you, like people say down here, like, Fitzpatrick 4, Fitzpatrick 5, Fitzpatrick 6, nothing you could do about your scars. You just got to live with your scars. You got to accept your scars. Just go to a psychiatrist, go to a psychologist, and just go like either medicate yourself or your scars or get a lot of counseling due to your scars. And Nafisa saying, I felt like I was scammed with these skincare products. And that's the thing, everybody's aware of all these practitioners that are like these QVC reps on TikTok, everywhere else, that are pushing all their skincare products and trying to claim that those are the ways that you need to solve your scars. This is what you got to do to solve your scars. And it's really like frustrating, really, when you actually think about that. Just think about that world, that really is what they were doing. And for so long, they were pushing this on people. And it's like the way that corporate medicine was structured. The way that it was just like it's underneath these private equity firms that made it so that they can't even focus on patients with their acne. They can't even focus on patients with their scars. And instead, they're told that you have to actually see X amount of patients, potentially 50, 60, even 70 patients a day. And what you're expected to do is you have to do it within a certain amount of time. If you're doing it longer than that, really you're going to go talk to the private equity rep there who's going to tell you that you spent too long on this particular patient. And they're going to say that, listen, for these acne patients, you shouldn't be talking that much about all this other stuff. Just have them go somewhere else to deal with that. You're just managing the medications. If there's something to biopsy, actually, when I was like 16 years old, this dermatologist biopsied a piece of my hand for no reason. I had a little rash on there, and she biopsied it. I was 16 years old. What were the chances I had a problem, actually? She biopsied. Actually, I had to remove the scar there because it was used to annoy me so much that she did that to me. So I was 16 years old. She called my mom and said, it's potentially skin cancer, blah, blah, blah. It was a rash, for God's sake. I told her that I had, I put some creams on there. Like I always tried, I would always like try random creams, and she ended up biopsying it. She biopsied a rash, and then the rash showed it was like just a regular, nothing special. And it's like wild that she charged that, but they are pushed to do that stuff because of the way these private equity firms have actually destroyed they've actually destroyed the healthcare system in this country. And that's why scars are so far behind. That's why acne is so far behind. That's why you'll talk to people and you'll hear over and over and over again that you didn't get actually proper results from the laser treatments that were being like thrown at you. People are spending, you know how much the halo laser and those jewels cost and those things? It's like $215,000 for the device, really. It's like a lot of times it's like $215,000. Those like these devices are so crazy expensive. There's a guy down my street that he paid $1.5 million for his equipment. He was asking me if I wanted to buy some of that, and he was like, none of the equipment was really just like was right for his patient population. His patient population is Asian, and almost all of his equipment that this rep sold him on was all for like Fitzpatrick 1 through 3. Terrible, actually, right? So now he's like, he may be pressured. I'm not sure. Like, I'm not sure if he is or not, but he may be pressured now to tell people that, hey, I got this device and it's going to work on your scars, because he's got a $1.5 million debt, which is going to accrue interest. And it's like, that's what he's going to have to do. Otherwise, it's going to have to shut down. So that's the state. So if you're wondering, man, why is it that we're so far behind with scar treatments? Why was it that we were pushed on like these lasers? Why was I pushed on all this other random stuff? That's the reason why. You hit it right there. Like, that's exactly the reason why. And it's so far behind because of the state of modern medicine today. That's the thing. It's like anybody with this stuff, anybody with acne, with scars, with pigmentation, anybody who's ever had any healthcare problems itself really should be radicalized, because it really should just be like an eye-opening experience for you to recognize how terribly unjust the system is. And like, it's just like, it's clear that the way the system is structured, the way it's so, the profit or all these margins that they're trying to shoot for, drugs that are $46 are trying to charge tens of thousands of dollars actually for HIV medications. And it's wild to people actually when you actually look at this. And it's like, you should actually look at this and accept the fact that this is just an unjust system, and we need to actually change this whole thing. That's what you should look at. Because if that's what if you're looking at your suffering scars and you can't come to me, at least recognize that that's a big problem actually, that this just needs to change. It is wild, right? Fine. It is wild. Let's see here. Moon81 is saying, is there a risk of TCA Cross making ice pick scars that are clustered from one huge indented scar? It is possible actually. But there's a lot of different options. You could change the concentration of the way you're doing the acid. Try not to do it to ones that are connected like that potentially. And then also you may need to do other modalities like lasers or a volume replacement too. Let's see here. If you had to pick one best treatment overall for atrophic scars, Subcision, Microneedling, laser, it probably is going to be Subcision if it's like rolling scars there. Up saying, what's up, doctor? Amazing results. How soon and often should one come back for touch-ups for TCA and volume replacement after a combination treatment? For TCA, you could do that even just after probably about 1 to 3 months after our combination session, depending how strong I went. Jonathan Lozaz is saying, I'm saving up money for scar treatments, moderate acne scars from out of state. How much should I save for those treatments? If it's moderate, probably closer to about $7,000, Jonathan. I'd be happy to help you. Just go through my page at drqazi.com. You can schedule a consultation. We can break it down for you so you can see how much it's going to cost. Cookies and Cream is saying, is carboxy therapy outdated or is it still relevant? I don't know if it's actually outdated, but I just don't use it because I just didn't think that it's going to help out too much with things, but I'm open to it, really. Sophia is saying, does low-dose Accutane still cause hair loss? How much would the dosage be to minimize side effects? So it's possible. It's just that you do have less side effects. It's just that it's not that there's no side effect with it. You still could get some dryness. You could still get hair loss. You could still get joint pain. And like, to answer your question, it's usually like 0.25 milligrams per kilogram as more of a lower dose, which potentially could cause less chance of side effects. But there still would be some side effects there. Y'all is saying, hi doc, my wedding is in November. Can you help my skin before that, or is there not enough time? Schedule now. Let's see what we could do. We'll see what we can work on there for that. Let's see here. Tyler saying that my acne was worse with I was surprised my dermatologist even allowed it because I came to you right after I did that and you saw the severity. Yeah, actually, I didn't even realize you did. I forgot that you did that many halo lasers. So Tyler did a bunch of halo lasers and now she already sees so much improvement with our combination session. It's going to look awesome, actually. We're at least doing it properly now, Tyler. Well, that's good. Sunset in Life is saying, I know you mentioned taking zinc and omega. Is there anything else you recommend for us to do at home to optimize results or build collagen leading up to the treatment? I'm still exploring other things, but basically there is actually a study that I was looking at that I'm actually really interested in. It's with a vitamin D supplement as well as a vitamin K actually, and that could promote wound healing a little bit more. So I may actually be incorporating that after we do scar treatments a little bit. So I thought that was actually pretty cool. So really, I think there's a lot of things in the wound care world, because the goal for all of us is to create more microvascular circulation, and whatever else we need to do that is on the table. So I'm open to a lot of actually options for that. So you'll see me kind of evolve and adapt and kind of see what other options. Right now at this point, I could recommend zinc and omega, sunblock, moisturizer, and I'm open to other things. In fact, actually, I'm using beef tallow right now, and I actually do like it a lot. So it may end up being something that I'm going to start pushing as well there, and see if that's going to also help out people. I don't necessarily think I will do it for scar patients just yet, but I may do it for like more of my anti-aging patients, things like that, and see how that goes. And then eventually, I'll try to incorporate that for some of my scar patients. You'll see kind of rapidly. I'm actually really liking it. I just use a lot of moisturizer with this still, but I think it's been really, really good actually for my skin. So we'll see. I may end up putting that actually as well. Talon's asking, can you recommend that sunscreen you use? I'm considering switching off the Alta MD soon. Yes, I'll have to double check on that again. I'll try to remember tomorrow. Remind me. I'll try to remember tomorrow. Would the Pico-Way laser work to get rid of my scars? It's not great for scars, really. It's good for pigmentation, not so much for scars, though. Let's see, your Moon is saying, in your hands, have you seen TCA Cross make ice pick scars become one big scar? I have not actually, myself, I have not had that issue, but I'm certainly aware of the possibility of that occurring, though. So I do think a lot of it is because of the concentration. I change the concentration depending on the scars and then how careful people are. You'll see, really, I mean, it's tough to, unless people show videos, but you'll see, like, if you're working with people, that a lot of people really have very shaky hands. They aren't very focused as they're doing things. And TCA requires a lot of precision. You know, it really does. I used to paint actually these action figures when I was, I actually still have a bunch that I was supposed to paint. I've been like really behind on it. Like for years and years, I was supposed to be it was like, something, a project of mine one day I'm going to do. But basically, I used to do a lot of it. And it was like, I had to be very, very precise with it. And it was also three-dimensional. It was like there was sculpted, there was like sculpture on there. And it was like, I needed to make sure that like it was done like really precisely. So I think that really helped out because I was able to like really focus and making sure I was really steady. And that's why I usually use a paintbrush or like just like small little needles, just something that I could just be really precise like that. It took a lot actually, just to literally, sometimes if you're losing focus, you have to actually just sit there and like just like look at it and just like zone everything else out and just focus on just that. And then you actually can just make sure that your hand is very, very steady as you do it. Very few people do it that way though. Triple X is saying, what do you think about 3D printing human tissue for skin? I'm excited about it. I think it could be awesome, especially for burn patients. I really, really plan on getting more into burns eventually. I do want to do a lot more with burns. I think it's going to help out a lot actually for the burn world especially. Talon's asking, do you think consistent exercise can help with collagen production once the skin is healed from initial treatment? Absolutely, yes, absolutely. A lot of patients, actually that patient I showed, I guess it was yesterday, or I can't remember now, but it was pretty much that fully polished, like complete result. He's like somebody who works out a lot. He's somebody who just like is otherwise very, very healthy and fit. And a lot of patients where it's more like that full polished, complete look, they're like people who are very active and very, very healthy there. Michael Margaritas is saying, not sure if you remember me, I'm 5 weeks on from punch excision, TCA Cross. At what point do you think I should judge final outcomes? I don't remember if you were my patient or not, Michael Margaritas, or if you're just somebody who was asking questions. But that's really early either way though. The TCA part takes several months. It could take like almost a year really for TCA. Excisions, you may see a little bit sooner, sometimes 3 to 6 months, you'll start seeing that rise a bit there, but it's like takes a while for it to rise. Haley is asking, did we do subcision? We did do subcision. Yes, I did do subcision on this and excision actually for that deeper scar. Fatima is saying, I did CO2 laser to remove my acne scars. Now I have hyperpigmentation as a result. Don't know what to do. Well, the easiest thing to do is to talk to your physician that did it and try to see if you can get a prescription for hydroquinone or Triluma. That may be something to consider. If you can't get access to that, You could do really a few different options. We have a pigmentation cream, which is no longer available on our website, but you could consider trying to get that from us. Or you could actually just get like Eucerin's anti-pigment cream. It's a light cream. It's got diamidol. See if that'll help you. It's a slow process, and maybe that'll be something. And plus, a lot of sunblock. We're reserving our pigmentation cream just for our patients right now, but we'll see. You know, maybe if you're a potential patient or so, we could figure out something. Exclusive, yes, he's saying, I need a consultation for rosacea. Just go click on our profile at drqazi.com. Go to our website, drqazi.com. You'll be able to go there directly and just book it right on there. It's super easy that way. With the potential weight loss, would there be a worry of texture resurfacing again? Not texture, but you'll see a little bit of that, those scars were supported with the fat that was over there. And Bellafill, though, we put some Bellafill there before. Bellafill will be really helpful to support that, though. So it's okay, because you're going to have something to support that. My weight, honestly, I like, if I lose a little bit of weight, it's like very obvious, but like at least I have some support there with Bellafill there. So it's nice for me, because it used to be like, as soon as I would lose a little bit of weight, it would just end up just getting like, just like more scarring visible. So now I have always a little bit of support there, which is helpful for me. How to treat papular nose scars? Good question. You do a few things. You do a little bit of laser usually on like each little big bulb. You go and use a CO2 laser or an Erbium laser to smooth that down. You can do some steroid, actually sometimes through the laser channel hole as well. That works out really well. And then you use silicone tape there afterwards, and that keeps it flat there. How long does Bellafill last? So it's the only FDA approved product for scars. It lasts at least 5 years. Most people find that it's probably pretty much permanent there. It doesn't get absorbed. The PMA doesn't get absorbed. Are you in Canada? I know I have a lot of patients in Canada, though. One of my patients today came in from Vancouver, or was actually originally from Vancouver. So a lot of patients actually from Canada, a lot of patients. So I will be happy to help you out, but I don't have any plans of being in Canada at this time, or anywhere else in the country, to be honest with you, in this country. So just to be honest with you, I just have a lot of stuff that I have to do over here. And so like, we got to make sure that it's like done at a very, very high level. And I do appreciate everybody asked like if I could go visit, you know, like the East Coast and like other states. But it's just like, I got to make sure this is done so well. There's so much involved. You know, anybody who's my patient knows they send photos to us every day. You know, for about 2 weeks, we look at those photos. There's so much that we have to do to make sure it's done so safely for everybody. So much my team does to make sure everything is done like in a certain way. We're like just like really, really making sure that it's just done really, really safely for each patient and done at a very, very high level for each patient. So it's like impossible to do that for like, I'm just myself. And so it's like, how do I go around everywhere and then also you know, make sure that our quality is done really, really well here. We're at least just 5 minutes away from the airport. That's why most of our patients do come from out of state, actually. And a lot of patients come out of the country. Mom, TikTok is saying, can I travel to you? Absolutely. Yeah. Thank you for asking that. Right on time. Exactly. Yeah. So that's exactly correct. So a lot of patients come, actually. Most of our patients, probably 65% or so patients, come out of state. And a lot of other patients come from actually Northern California. My patient today came from Sacramento. There's a lot of patients that come from the Bay Area. Actually, 2 patients came from the Bay Area. One also, he drove all the way down from San Francisco. He was just 6.5 hours. So that was I really appreciated that. But yes. Oh, water of the day. Oh, is that you today? I don't want to say your name if it is, though. But was that you today? That came in from Sacramento. Keep it sentence saying, how many days do I stay in the area post phenol peel? Is there a minimum? You know, we recommend really just staying the full journey for that time, but you don't have to. If you are somebody who needs to go back, at least give it though for the first 4 days or so, 4 or 5 days. And then as long as you have a caregiver, things like that, that should be okay then for you to go back. It's not like it's obligatory for you. And it's just a mask that comes off pretty easily afterwards. I followed up with 2 phenol peel patients actually, and actually they're looking amazing actually. And I believe we have a couple others that are going to let us share results really soon too. So that's going to come out too, actually. What factors determine the percent of TCA used for procedures? It depends on the depth of each individual scar. And that's the thing. What it really is the depth of the scar, how wide the scars are. Those are the things I'm taking a look at. The location of the scar. There's a lot that's involved with it. That's why I always really cringe when I see people like say, like, I got, I bought some TCA on Amazon or something like that. It's like, I would never do TCA on my own face. And I do like the most in the world of this. Like, I just would never do it. Like, it's just, there's so much involved with it that to make sure that like the patient's completely flat, you have to make sure you're really, really steady as you're doing it. And I just like would never do it that way. So the percentage does change though. It's like actually today, a lot of my patients were like had done 3 to maybe even 6 times of TCA, and later on I'm just doing like lower dose, lower concentration because it's so superficial now, which is the whole point of the whole thing, right? So it's like getting more and more superficial, and it's a lot easier now for us to manage now. Nafisa saying, I used to live in OC and my skin was the best when I lived there. I hope to be back and see you. Look forward to seeing you, Nafisa. I will see you really soon. I'm going to wrap up tonight though. I'm glad actually we got this done. Airman's asking for a video call. I don't have people come on these lives for that though. Really, maybe at some point we'll do it, but it's like too complicated typically for us to set up. But I would actually try to have at some point, more photos that people submit. So if you go to my page, there's like a form over there. You could submit it actually over there if you want me to talk about it during the lives. But really, I mean, that's going to be like random. The best thing to do is just do a consultation. I could go through everything in person there. Talon saying, I saw that my concentration was labeled mild, so I was curious as to why. Oh, so what we're doing is we do a mild, moderate to severe for like the TCA. It's just our way of indicating like basically if there's just a few like spots that I have to do it, if there's like normal amount of spots that I have to do it, or if it's more severe cases a lot of times where it's like there's a lot of the ice pick scars, it's covering a whole lot of the surface area, and that it's going to take me a lot more time. It's just basically their way of knowing like how much time it's going to take or so. Michael saying, thanks a lot, Dr. Qazi. You're awesome. I appreciate you, Michael, too. Thank you so much. So I'm glad that you're going to continue to get better and better results too. And I appreciate everybody that coming over here. Do you come to Cyprus? Are you talking about Cyprus in their Greece, the island Cyprus? That'd be cool. I like Cyprus. That'll be cool. So it looks really pretty. But I'm not going to be going all the way over to Cyprus per se, but maybe something around in that area one day at some point though.